Hi, Jason. I'm going to be your occupational therapist today. My name is Julia. How are you doing today?
Doing okay. How are you doing?
Pretty good, pretty good. Can't complain. The sun's shining,
The
right?
sun is shining.
Yeah. So I heard you had an accident a little bit while ago.
I
Yeah.
hit my head.
Okay. And how are your eyes feeling today, and your head in general, I guess?
I have a little bit of a headache. My eyes feeling okay
Headache.
today.
Your eyes are okay?
Yeah.
Yeah. So your headache, is that because you've been like trying to use your eyes a lot, or what did you do earlier today? Did you have any therapy?
No therapy. It just kind of started hurting when I woke up.
Right when you woke up?
Mhm.
Yeah. And okay, that's hard to deal with. How has that been going?
It's been okay. It's been okay. It gets worse throughout the day. Sometimes it kind of fluctuates.
Okay. What times is it worse? What times is it better?
I notice when I'm up and moving around, sometimes it'll get worse.
Okay, gotcha. And then you're using a wheelchair right now though?
Mhm.
Okay. And then when you're in that wheelchair, do you find that you bump into things?
Occasionally, yeah.
Okay.
Yeah, I'll bump into things on my side that I don't see.
Do you recall which side of you that is? No? Okay. Well, that's something we can look into today and test for, okay? And then tell me about when watching hockey. I was reading in your chart that you enjoy watching hockey.
Love hockey, yeah.
Yeah. And do you find that your eyes or your head hurt or get tired when you're watching hockey?
Yeah, my eyes will get tired and I'll start to feel sick after I'm watching hockey for a couple minutes.
Okay. Okay. And then do you think it's because you're just having to watch the puck go back and forth, or
I have no idea.
you have no idea?
Mm-mm.
Okay. Did you ever play hockey yourself?
Yeah.
Yeah? Okay.
I grew up playing hockey.
Okay. And then do you find that you have sensitivity to lights? Like when you're in your room, do you like to turn the lights off? Or if you're looking at a TV screen or a phone screen, do those lights bother you?
I haven't noticed it from a TV or from, well, maybe a little bit of TV, but I'm from my phone. Mostly just
Okay.
the lights, bright lights.
Like the fluorescents?
Or like going outside at first.
Oh, the sun.
Mhm.
Yeah, okay. And then have you been reading anything at all? Are you able to read since your injury?
I've been reading a little bit, but just really off my phone.
Okay.
And like I said, I kind of have headaches throughout the day, so I don't know if it's necessary for
Right.
that.
Right. When you have that headache, do you try not to read too much? Yeah.
Yeah, I kind of just try to relax.
All right, well, we're going to get into some tests for your eyes now. And I know they can be a little bit tiring, especially after an accident when you're having a headache. So I apologize that we have to do them
It's okay.
during your headache. But so the first test we're going to do, it's called the Hirschberg test. And I'm just going to be shining this light on the bridge of your nose, and you can look at the light while I do it. And we won't do it for too long because I know that you have some sensitivity to light.
Mhm.
And I'm going to observe where the light is shining in each of your eyes as I do this, okay? So you'll just look at the light. And I do kind of have to get close to you during those tests, so if at any time you feel uncomfortable, I can back away, okay? All right. Let me make sure I know how this light works. Okay. All right, thank you. That one's done. So that was the Hirschberg test. And now I'm going to be looking for your alignment. So I'm going to just briefly from, not too close, I'm going to cover one of your eyes and just kind of see how your two eyes work together, if they're able to adjust to having one covered and then the other.
Mhm.
So you'll just look at my nose the whole time while I do that, okay?
Mhm.
All right, and now the other side. All right, that looks really good. So that was our alignment test. And next we're going to do fixation. So you're going to focus your attention on my finger for 10 seconds, and we're going to have to do it 3 times, unfortunately, which I know can get tiring. But so we'll start in the middle, and then we'll do each side, okay?
Mhm.
All right, so focus here. All right, and we're done there. And now we'll do to this side. All right, nice job. And then one last one to this side. Good job. You need to blink a little bit,
All
close
right.
your eyes.
Get Ian Woodward out of it.
Yeah, that one can be a little bit tiring even when you don't have an accent. So that one gets a little bit tiring. So next we're gonna check your eyes, both of your eyes separately, the range of motion. So I wanna see how far you're able to move your eye and if you're within the normal limits or if your accident is affecting that, okay?
Mhm.
So you can cover either one of your eyes right now, okay? And I'm gonna just move my finger and you're gonna follow it, okay?
Okay.
Okay, you can uncover. And now we'll do the same thing. Yep, cover the other eye. Perfect. All right, and then you can give your eyes a quick break. That was our range of motion, and your range of motion did look good, so
Okay.
you're not having any effects with that. Next, we're going to do smooth pursuits, and this is to see how well your eyes can follow a target that's moving smoothly, and you're going to use both eyes open for this one, so it's a little easier in that sense. We're not fatiguing one eye, but I'm going to start out slow, moving in a figure eight, and then I'm going to get faster. All right, so we'll start in the middle, and if you're not able to follow, just tell me, and we can take a break, or we can try again, okay? All right, nice job. Okay, the next one is called saccades, and this one will just be to see how you're able to move your eyes back and forth between two targets. And we're going to do this one side to side and then also diagonals up and down. So this one, I know this is kind of what you do when you watch hockey, when you're following the puck, and I know that hockey sometimes fatigues your eyes. So we'll just make sure that you're able to do this, or if you're not, that's okay too. So just take your time and then go as quickly as you can. So first we'll go from side to side. So look from pink to yellow about 10 times. I'll tell you when to stop. All right. And now we're going to do up and down. Okay. And now we're going to do diagonal. Okay. And now the other diagonal, and we'll be finished with this one. Okay. Nice job, Jason. I know that one can be tiring,
Yeah,
so I apologize. Yeah. Are you feeling pain or
A little bit.
or just more tiredness?
Yeah, tired.
Yeah. Okay. So those were saccades, and now we're gonna do accommodation, which is similar to saccades, but I'm gonna have one marker a little closer to you and one a little further. One about 12 inches and one about 18 inches from your eyes. So now you can look back and forth between the pink and the yellow and tell me, and I'll tell you when to stop. Okay, and were you able to focus on them each time?
I think so.
More or less? Okay, good. So that was accommodation. And now we're going to do, this is called convergence and divergence. So I want to see how your eyes work together. So again, both eyes will be open. And I'm going to move the pen closer and further from you, okay? And if at any point it turns into double vision, so I'm only going to be holding one marker, but if it starts to look like I'm holding two markers, even though you know it's not two, you're going to let me know. But it is normal to see double as I get closer, okay?
Okay. No.
Okay, and then tell me when it goes away.
No.
All right, nice job. So that was convergence and divergence, and your eyes were working well together as you did that, so that's really good. And now, since you did mention that sometimes you have difficulty seeing things on one side of your body, I do want to do a couple more tests to kind of further inspect that. We call it neglect, when your brain's unable to pick up objects on a certain side of your body, okay? So I'm going to do first visual midline shift is what we call it. So I'm going to see if your eyes are able to know when you're at your midline. So when I'm moving from this side to the center, I want you to tell me when the marker is at your nose. So when you're looking at me.
No.
All right. And then we're going to do from this side.
No.
Okay. And now we're going to go from up top.
No.
And from the bottom.
No.
All right. Nice job. So you actually did that test really well. So your midline is your actual midline. So because sometimes when you have an accident that affects your brain and your eyes, you actually have a shifted midline, and it's really good that you don't have that. So this is the last test we're going to do. It's called confrontation testing. And so I'm going to have you cover one eye. You don't need to do it quite yet. I'll explain it. Cover one eye, and I'm going to be showing numbers in different planes of your vision, and you're going to tell me what number it is if you can tell, okay? So first pick an eye that you can cover. Okay, perfect. All right. What number?
1.
What number?
2.
What number?
4.
What number?
1.
Nice job. All right, you can switch eyes. What number?
1.
What number?
5.
What number?
2.
What number?
5.
Good job. All right, so those are all the tests that we need to do today. And since you are still having double vision a little bit sooner than you would if you hadn't had the accident, generally people don't have double vision until they're within 4 inches of their eyes. You had it a little bit sooner. And then also just due to the headaches and nausea that you've been having, I want to refer you to a couple of specialists to further figure out what's going on with your eyesight, okay? So we're going to send you to a neuro-optometrist, and they specialize in the eyes. Sometimes there's different lenses we can give you to help you if you're experiencing double vision, and they're called prism lenses. And then I'm also going to refer you to a specialist OT that specializes in brain injuries. So since you did have that accident that affected your brain, we're going to refer you to a brain injury specialist who's also an occupational therapist.
Sounds good.
And then I know you've been asking about that candy bar
there it
all
is.
day, and someone dropped it off for you, Jason.
Oh, thank you so much.
You're welcome. And it was nice meeting you today.
Nice meeting you too. All right.